Allergic rhinitis. Rhin comes from the Greek word nose and itis means inflammation. So it means inflammation of the nose. Allergic means it is caused by allergen. Allergen are anything harmless or neutral that can be inhaled in air by nose and trigger excessive immune reaction. Common examples of allergen include pollen and dust. Once inside the nose, they will meet immune system, particularly the mast cell attached to IgE antibodies. Allergen will bind to IgE antibodies, which will then activate an alert mast cell. In normal person, the reaction is minimal, but in those persons suffering from allergic rhinitis, this cell overreact big time. It signals to all the cells in surrounding by releasing histamine. Histamine will now cause inflammation and swelling up of the nasal mucosa, which will then cause excessive mucus production. This results in nasal drip. This excessive mucus production will block two important structures opening in the nose. One, nasolacrimal duct. The purpose of this duct is to drain tears from the eyes into the nose. But once blocked by excessive mucus production by allergic rhinitis, now you will start having watery eyes. Second, eustachian tube. This does drainage of middle ear. With its blocked too excessively by mucus production from allergic rhinitis, now you will have stuffed ear. And finally, the nerves of the nasal cavity will start getting irritated and lead to sneezing. All of it will lead to difficulty in breathing for persons suffering from allergic rhinitis. To summarize, allergic rhinitis will lead to 1. The swelling and congestion of the nose, 2. The watery eyes, 3. The stuffed ears, 4. Nasal drip due to excessive mucus production, 5. Sneezing, difficulty in breathing. For diagnosis of allergic rhinitis, 1. Patient history. Usually the person complains of all the symptoms mentioned above, and if the timing of the symptoms is specific and seasonal, then one can easily reach a diagnosis of seasonal allergic rhinitis. Second, skin prick testing. In this test, allergen is introduced using a skin prick and the reaction of the body is seen to confirm the allergy to a particular antigen. Blood test. A. Total eosinophil count. As with total serum IgE, an elevated eosinophil count supports the diagnosis of allergic rhinitis. B. Total serum IgE. This is a measurement of total level of IgE in blood. An elevated level of serum IgE supports the diagnosis of allergic rhinitis diagnosis. This can be performed using radioallergosorbent method, hence it is also called as RAS test. D. Nasal smear. A nasal smear can sometimes be helpful to establish the diagnosis of allergic rhinitis. A sample of secretions and cell is scraped from the surface of the nasal mucosa using a special sampling probe. Treatment of allergic rhinitis. It is achieved by targeting different steps and pathways to allergy. 1. Avoid allergen. This can be done by taking precautionary measures to avoid exposure. For example, wearing face mask in pollen season. 2. Decrease inflammation. This can be achieved by steroid spray applied directly to nasal mucosa. 3. Antihistamine. These targets the action of histamine by blocking histamine receptor, thus stopping the action of histamine. 4. Mast cell stabilizer. Mast cell stabilizers are common medication used to prevent and control certain type of allergic disorder. They block a calcium channel essential for mast cell degranulation and stabilizing the cell, thus preventing the release of histamine. 5. Immunotherapy. When you get immunotherapy in form of allergic shots, your allergist or doctor injects small amount of substances that are allergic to allergen under your skin. This helps your body to get used to the allergen, which result in fewer or less symptoms of allergic rhinitis.
Through your head, 'cause you've been